Hi everybody, this is Dr. Albert Melvey, also known as Dr. Vein Eraser, here at East Bay Vein Specialists. And today's topic is spider veins during pregnancy. When should you worry? So this merits going back and talking about spider veins versus varicose veins, again, because they're two different things. And while neither of them should make you actually worry, one is more significant than the other. And so let's talk about that. So spider veins are little thin blue veins. They're usually smaller than 1 millimeter, definitely smaller than 3 millimeters, and they're in the skin. They usually look like dark purple or dark blue, and they can typically be on the outsides of the legs, although sometimes we'll find them around the knee and the back of the legs. You can really find them anywhere, but the most common ones on the outside of the legs. The most important thing here is, though, they're in the skin layer and they're really thin. Now, I want to contrast those with varicose veins, which are these large, bumpy veins that are found in the thighs or the lower legs. And those have a 3D appearance. If they have a color, they're usually going to be a light blue because they're down deeper in the skin. So varicose veins are coming from deeper in the skin, usually a result of a circulation problem. Spider veins, totally cosmetic, and they're just in the skin layer. All right, so spider veins during pregnancy. These sorts of veins during pregnancy, when should you worry? The answer is never, okay? So if you have a crop of veins, and they truly are spider veins, the skinny little blue and purple veins that are in the skin layer, and they're, to you, more noticeable during pregnancy, that's not a reason to worry. After the pregnancy is complete, and usually after another 3, 6, 9 months have passed, many of those veins will go away on their own. For the ones that don't go away on their own, you can always have cosmetic spider vein treatment. We typically treat these with sclerotherapy. So that's where we inject a medication to make them disappear. We don't do that treatment during pregnancy because we just don't know the effects of that medication on the fetus, so we just wait. The other reason to wait is many of those veins will just go away on their own. So if they're going to go away on their own, there's really no reason to treat them during pregnancy. So spider veins during pregnancy, when should you worry? Never. Now, varicose veins during pregnancy, which are these bumpy, larger veins, these can be really uncomfortable and painful during the pregnancy because the uterus, which is enlarged, which is sitting in the pelvis, can actually block off some of the blood we're trying to return from some of these veins and make varicose veins, which are abnormal anyway, worse. So it makes the pressure and the heaviness that people like this are feeling in their legs at any given time worse because there's the pressure of a 20 or 25 or 30 pound uterus sitting on top of that vessel that's trying to get back, and so it makes the vessel more engorged, more dilated, more full, and that's uncomfortable. So if you have varicose veins during pregnancy, it's really important to wear a compression sock, and it might be a short compression sock if the veins are just below the knee. Some people might be a longer one if it's someone who has a lot of varicose veins in the thigh, as much as possible during the pregnancy. And then when the pregnancy is complete, you can come in to me or someone like me and see about having these dealt with. Because once we fix these, for 19 out of 20 people, they're sort of fixed for life. Especially if you're planning on having future pregnancies, you want to treat this before future pregnancies so that you don't have to suffer through the pregnancies afterwards. So there is this old wives' tale of you should have all the pregnancies first and then treat your veins. And that is terrible advice. It is my least favorite piece of medical advice. That's like saying you should have 3 babies, never lose any weight in between, and then try and lose 100 pounds after the 3rd. Bad advice. So these can be treated where we find the root of these veins with ultrasound and then treat them so that the veins don't crop up. One important caveat that I want to add. So varicose veins during pregnancy, when should you worry? There's one real episode when you should worry. If these veins, and this is true whether you're pregnant or not pregnant, if these veins become red, hot, hard to the touch, and painful, that may mean that they have a little clot in them. The fancy medical word for that is superficial thrombophlebitis. Those words mean it's close to the skin, superficial, it's clotted, thrombo, and it's irritated and inflamed. That's phlebitis, superficial thrombophlebitis. So that can hurt, and it can also make it harder to treat down the road. Using a compression sock will generally prevent that. In very rare cases, those clots can turn out to be actually serious medical issues. Usually they just hurt, but sometimes they can actually cause real medical problems with the lungs or heart. So if those veins become hot, hard, painful, then you want to make sure that you see a doctor and have an ultrasound of that area and start wearing a compression sock right away if you haven't been using one to that point. So to sum up, if you have varicose veins and you're pregnant, wear a compression sock to cover them up. After pregnancy is completed, see a doctor that you trust who can take care of them and deal with them. If you have spider veins during pregnancy, wait a few months after. They may go away or go down on their own. If they don't, after about 3-6 months have passed, come in and you can get them treated cosmetically. And getting them treated in between pregnancies is a great idea because that's fewer veins you'll have to treat later on. So that's what I have to say about that. Goodbye, till next time. Thanks.